lack of awareness, so people don't get out and access the services. So Tara's been working on creating awareness, but we see a lot of mental health challenges in our community. So in addition to that, even aged care and disability services, there's a lot of difficulty in accessing everything we do because of the cultural and linguistic barriers. So it will be really good if we can have some cultural, linguistic specific services to improve the Tamil communities.
Thank you for that, and I'll just add the general comment because it picks up on here so you can address the topic in one go. The question here was, what's the government's approach to overcoming cultural and language barriers that families from diverse backgrounds face in accessing healthcare services? And also from the practitioner point of view, are there training programs and help for healthcare professionals who want to improve their capability or of their practice to help overcome some of those barriers?
Thanks very much for that question. It's such an important one. I think these issues of ensuring that our healthcare system is culturally sensitive means different things in different parts of the system. So in general practice, we have a really diverse general practice workforce that I think serves communities really well. Maybe not perfectly, maybe there is a bit of a mismatch in some parts of the country between the sort of make up the local community and make up the local GP workforce, but I look around here and talking to a number of the GPs, I think generally that matches pretty well. Two areas that you've mentioned that I have always been more worried about is firstly mental health. Because to be blunt, I think our mental health system is very much built around Anglo notions of mental health. And as a former mental health minister, I am very conscious of that bias in our system, and that when we have round tables about how to think about the future of mental health, they're very white. And this is something I've talked to a number of groups about, sort of really seeking advice and guidance about how we improve that, how we change that and make sure we've got a system that's more sensitive to different cultural ways of dealing with mental health issues. I have to say, as in so many areas, young people are a bit ahead of us. I was just at a Headspace service a couple of hours ago where their Youth Action Committee, which Headspace is very much led by young people. Young people have a really important say in how their local Headspace configures its services. And the service there, which was servicing communities with a lot of international students, it was really focused on this. So this was their number one, number two, number three issue. And I was really taken by that because I haven't seen that as much in adult mental health areas. So if you've got some ideas, I'm really thirsty for that. There are some groups at a national level who are thinking about that, but I'm not sure we've sort of really connected sufficiently. FECA, the peak body for ethnic communities in Australia, has started thinking really carefully about how it can bring multicultural health leaders together as at a national level and to engage with us as a federal government about how we can deal with some of these systematic things, but that's pretty early days. Let me finish by saying aged care, which is a real passion of mine. Hawke, great man, thought about this really carefully in the 80s, and Brian Howe and his ministers thought really carefully about how we made sure aged care services were culturally sensitive. But those priorities then were very different. They were essentially about the post-war waves of migration. So, the Greek community, the Dutch community, the Italian community, they're very well served by aged care facilities that are led by those local communities. There was a lot of investment by Bob and his government. I tried to do a lot of that when we were last in government, with a lot of capital grants into communities who were the sort of second and third waves of migration post-war, whose communities were ageing. the Vietnamese, the Lebanese community, the Filipino community, and there were others as well. And there was funding there, so you've got to be able to build facilities, you've got to be able to train workers, you know, configure your service properly. It's like and build that capability in the community. And Annika and I are thinking about how we do that now with waves, the sort of subsequent waves who are now having their mums and dads who are getting older and need of services. You know, this is really important. If you're a genuinely multicultural community, that should go from birth to grave. And aged care services are not just culturally important. We know, I talked about how prevalent dementia is now in aged care facilities. We know about language reversion. But one of the consequences of dementia is you will often use your second language. So even if someone really is quite fluent in English, dementia will cause them to lose that and revert. So language, culture, food, the physical layout of a facility are terrifically important for those final phases of life. So please stay in touch with us about that, and I extend that invitation to other groups as well. A couple of you have already talked to me tonight about that ambition for your community.
Okay.
Thank you.